Hello, everyone, and welcome to our latest online event here at the University of California, Merced. My name is Ricky Hill, and I am the e-recruiter here at UC Merced. A very big welcome to you this evening. Of course, as always, we are so thrilled that you can take some time out of your evening to spend with us here. Tonight, you are in for a treat. We will be talking about the UC Merced Pre-Health Advising Program. Before we get started, let me give you just a couple of quick reminders regarding Zoom. If you need to adjust your audio settings, you can do that in the lower left corner of your screen. If you would like to at any time increase your view of your screen, you can click on View Options that you should see at the upper portion of your window. And lastly, as always, we do want to answer your questions tonight. So go ahead and click on that Q&A button, send in those questions, and we will be getting to those throughout the presentation as well as towards the end in a live Q&A session. Once again, my name is Ricky Hill, the e-recruiter here at UC Merced. Such an honor to be here with you. At this time, let's go ahead and get things started with introductions, and I will hand things over to my colleague, Jen.
Good evening. My name is Jen Souza, and I am one of two pre-health advisors here at UC Merced. I'm also an academic advisor for second years and above for everything but bio. And I will go ahead and kick it over to Erica.
Good evening, everyone. My name is Erica Robbins, and I'm the Director of Student Services in the School of Natural Sciences and the other pre-health advisor. So tonight we're going to go over some general information about how our program supports students intending careers in healthcare. And like Ricky shared, there are people behind the scenes answering questions, so please don't hesitate to put questions in the Q&A. My hope is that we'll be able to cover all of your questions through our slides, but if we don't, please let us know. We want to make sure that you have all of your questions answered before the conclusion of our session. So tonight we're going to go over the topics you see here. So we're going to talk about the pathway to a healthcare profession and what that looks like. We'll go over kind of some components of what makes a competitive applicant for health profession school. We'll talk about the selection of a major and why it doesn't matter, along with course prerequisites that are required for most professions, the importance of experience in and around community and healthcare. And then we'll get into actually what services does pre-health advising provide, and then share a little bit more about professional school admissions statistics and next steps. And then we'll finish out with questions and next steps after tonight. So this illustration shows a general pathway to becoming a healthcare professional. So depending on if you're a first-year student coming in, or if you're coming in as a transfer student or coming directly from high school, that's great. Either way is fine. A four-year college degree or courses at a four-year college are needed. So whether you're coming in as a community college transfer or you're coming in as a high school student, it's all good. So completion of a four-year degree plus required prerequisites is needed. From there, you go on to professional school, which could be 3 to 4 years, depending on the type of the program. So when I say professional school, I'm talking of medical, dental, pharmacy, veterinary, physical therapy, occupational therapy, physician assistant, and others. That's just a sampling. After completion of the professional degree, there is residency training for most of these professions, and that's another 3 to 5 years. And the residency training is where you actually learn how to be a surgeon or a gynecologist or a pediatrician or a psychiatrist. After that, there's an optional fellowships and that training can range 1 to 3 years depending on the specialty. This is further training, maybe in like pediatric orthodontics, something along those lines where it's highly, highly specialized. After that, you're a practicing professional and you can join a practice, buy a practice. That happened to my dentist. He purchased a practice, join a clinic or a healthcare management organization. The sky's the limit. It really just depends on you and where you see yourself working and the type of patients you see yourself serving. But the learning never really ends. Continuing education is a key component in a healthcare career. You really need to be a lifelong learner to work in healthcare. You have to stay abreast of new findings, new technologies, new treatment opportunities. And so there's opportunities to engage with your profession and earn those continuing education units. So it's kind of like additional schooling well above and after you've already completed your formal training. So what makes a competitive applicant? So there's 3 kind of chunks of how we view a competitive applicant and ways to develop that competitive edge. Your first step is strong academics. So when we talk about academics, we're looking for a competitive GPA, both your cumulative GPA, which is everything you've taken, and then the science classes that are required for a particular program. There's also test scores. So the MCAT, which is the medical college admissions test, the DAT, which is the dental admissions test, the PCAT, which is the pharmacy college admissions test, and the GRE are some examples of the most popular ones. Those are achievement tests, and for the most part, they're measuring what you know in science courses and other non-science classes. So you really want to have that strong GPA and then strong test scores in those areas. Meaningful experiences is another key component. So that is experience in the field. It could be research, community service, paid work, volunteerism. It really depends on you, what you're passionate about, and where you want to contribute. So it's through the meaningful experiences that really we want to develop your application such that you can clearly articulate why you're a good fit for the profession, and how have you demonstrated it? How have you learned about the field, and what makes you unique what unique characteristics do you bring to the table? And then finally, that personal narrative. So from the experiences, hopefully you'll be able to communicate that commitment and passion and articulate why you're a good fit for the profession. And the personal narrative, you demonstrate that through your personal statement, the secondary application, and the interview process. So selection of a major, there is no pre-health major. You're not going to find that in most places. No major or minor gives students an advantage over others. And in general, the admissions committees have no preference on a particular major or minor. Students are free to major in a field of their choice, and we really want students to choose a course of study in which you will excel and be excited to learn and something you're interested in. If you look at the data, yes, most pre-health students are majoring in the sciences, and that's because of the amount of overlap between the required classes that we're going to take a look at in just a moment and the major requirements. So you don't have to major in the sciences, but most students do. Again, we want you to choose something that you're excited about, even if it's a global arts major. We will help you then kind of craft together what that schedule looks like. You got your major classes and then the pre-health classes as well, but you're free to choose whatever major you would like. So like I mentioned, those prerequisite classes. So this is a list of the most commonly required courses to give you kind of a sample of what you're looking at in terms of preparing for a career in healthcare. So the ones that have specific professions attached to them over here on the right-hand side. So a semester of public speaking and economics. Those are unique to pharmacy preparation. And then most of the other ones are commonly required by all professions. So 1 year of general biology, 1 year of general chem with lab, 1 year of organic chemistry with lab, 1 semester of biochemistry, 1 year of physics, 1 year of math, and 1 semester of statistics, and 1 year of English. Those are common across pretty much all of the health professions. 1 semester of psychology is recommended for medicine, pharmacy, dentistry, and nursing. And then microbiology, anatomy, physiology, those are required for nursing and then physician assistance training programs as well. So we also want to point out that most all of these classes are available at UC Merced, and it's totally fine to take lower division science classes at the community college, or even some of the non-science classes at community college. So if you're coming in from community college, that's excellent. If you're a first-year student and you're thinking about taking some of these classes over the summer at community college, that's also perfectly fine, and we'll work with you to make sure that everything lines up. Experience. So like I shared a little bit ago, experience is crucial. You have to have really strong academics, but how do you know that this is the right career for you? So the main way to find out about that is to get some experience in the field. So is it really what you expected it to be? So through experience, we hope that you find out what the career is all about. We've had students share that they've seen it on TV and it looks really cool. What you see on TV is definitely not real life. So we want you to get out there in a real world working environment and see what it looks and feels like to you. We hope that through that experience, you'll be able to clarify and validate those initial impressions. So maybe you had a wonderful experience as a child with your family physician, and you want to give back to the community in that way. So getting out and seeing how How does it look? What does it look like to be on the provider side is going to be really important. Through experience, like I said before, improving the articulation of your goals. Some professions have specifically required hours, such as pharmacy and physician assistants. You really want to start thinking about what that looks like for you in terms of how do you want to go about gaining that experience to make sure that you have the right number of hours before you apply. We do want students to choose experiences that are appealing and important to you. And so if you're passionate about mental health, engaging in activities and in spaces that promote mental health awareness, or getting patients connected with clinicians, whatever that might be, that's what you want to start thinking about, is how can you get involved to learn more about the field, learn more about yourself, and to make sure that this is the right pathway for you. So at UC Merced Pre-Health Advising, we provide a variety of services. So this is highlighting just a bit. So we do provide guidance in becoming a competitive applicant. So checking in with you to see, like, where are you with your academics? When is the right time for you to take your MCAT? What does that look like? And then what is your experience? What are your plans for gaining experience, and where can we support that? We do offer workshops and events every single semester. So we do offer introductory workshops online so that students can learn more about the preparation for that specific profession. So we offer a variety, including medicine, dental, pharmacy, PT, nursing, all sorts. I can't name them all, but those are available so students have an opportunity to learn what's out there. We do assist with course selection and planning, again, making sure you're taking those science classes at the appropriate pace. The science classes are highly sequential, and we want to make sure that you're taking them in the appropriate pace and order to finish it on time in preparation for what exam you need. And then we do provide assistance throughout the application process. The entire application process takes over a year, and we're there to help guide you, making sure that you have a strong personal statement, good secondary applications, and also as a sounding board to support you during that very stressful time. And then finally, connection to opportunities. So if you do come to UC Merced in the fall, we will be sending out information on our services and opportunities. You can sign up for our mailing list, and then we'll start to share information as we get it. So again, we'll promote those workshops and events, but also any other opportunities that are that's pre-health related. All of that is sent out on our mailing list. So some examples of those pre-health opportunities. So we really recommend on-campus employment. We employ students in our office, and I'm a big proponent of on-campus employment. So HEROES is a health education, there we go, opportunity through our health center staff. And that's an opportunity to get out there and do some peer health education. Undergraduate research is a huge opportunity on our campus as well. So all of our faculty have undergraduate students working in their labs on their research teams. So some examples include working in a health psychology lab, public health, and then health sciences as well. And so it doesn't have to be in a biology lab, but that's an opportunity too. You have opportunities to kind of collaborate across the disciplines, depending on what's interesting to you. The LEAD Pre-Health program is a leadership development program for 3rd and 4th year students. And we actually just wrapped up our 3rd cohort of LEAD Pre-Health. They gave their final presentations last week. Student clubs and orgs. So these are fantastic opportunities to connect with like-minded students. And so there's a variety of organizations on campus. Some are career focused. So there's a bunch that are focused on pre-health or pre-med. It really just depends on you, and if you want more like a broader experience with pre-health, or if you're thinking specifically about nursing, there's a nursing club. There's also interest-focused clubs such as the baking club or other cultural-based clubs. So again, another opportunity to get plugged into our UC Merced community. And if you advance in the club leadership, developing leadership skills, that looks amazing on a medical or dental school application as well. There's also paid experience available with community employers. So getting connected with our Student Career Center and looking out into our community for those paid opportunities is another way to bolster your application. And then community involvement. There's service opportunities. Again, getting out and serving the community, seeing what it's like to work with people is another great way to enhance your application. And again, to learn more about yourself. And then volunteering, there Mercy Medical Hospice, and then the UCSF Fresno Mobile Heal Clinic. So those are more direct patient care clinical volunteer experiences. And so those are available as well. And we'll forward that information out as soon as we receive it as well. So we do want to comment a bit on professional school admission. So one of the questions we get a lot is, what is the acceptance rate of UC Merced students into professional school? So that question is difficult to answer for a number of reasons. The first is it's difficult to calculate. So while we may know of some students who are in the application process, and we might know how that application turns out, students are not obligated to share that information. And so we do not have reliable data on what the acceptance rate of our students actually looks like. And instead of focusing in on a number, a percentage, we really encourage prospective students to instead consider, how does the institution provide research and community involvement opportunities, academic and pre-professional support, and then academic and pre-health advising services. So I've touched on all three of those areas tonight, and we provide these opportunities for students, and it's ultimately up to the student to utilize them. So we recommend students attend the university where they feel they will be able to best prepare for their intended career, and where you feel like you're going to be able to grow in that space. So for us in pre-health, we recommend students check out our website, which is prehealth.ucmerced.edu. There's a ton of information out there on the preparation for each health career that we support. You can see the list of classes and more of a deeper dive on some of the topics I've covered tonight. You can absolutely check that out now. We do recommend students start researching schools and programs now as well. So it's not too early to start looking at like UCSF School of Medicine. What does that program look like? What does UC Davis look like? How are they different? Kind of learning about those programs and the type of students that they're looking to attract can help you kind of figure out, where do you feel like you're going to fit in for that next step, even though it's several years away. The preparation for that starts now. Once you submit your statement of intent to register later this summer, we will send out an email with information, but you can subscribe to our mailing list now at that link that you see listed there. We do require students to attend an introductory workshop in the fall semester before making an individual appointment. The reason for that is the introductory workshop is going to cover a lot of the nuts and bolts questions that students tend to have, like, what classes do I need to take? When do I take the exam? And so forth. That makes having that knowledge in advance makes an individual appointment much more productive. And then we can really talk about you. Where are you in this process? Where do you want to go? And how can we assist you in getting there? Follow us on social media. We have Facebook and Instagram at the handles that you see listed there. And we're happy to interact with you on social media. All right. So I'm happy to take questions now, or whatever Ricky suggests.
Whatever Ricky suggests. Let's go ahead and dive into some Q&A while we're still on this topic of pre-health advising. Thank you so much, Erica, for that great presentation, as always. And let's see. So our first question coming in here. What are your top programs to get students ready for medical school?
So, like I said, biology is the most popular because of the amount of overlap between the degree requirements and those required classes I went over. Our quick plug for our biology program, it does have 5 emphasis tracks, and students are able to pick out any of the 5 and prepare for healthcare. That's totally fine. The human biology one has the most overlap. It's almost completely shared. So human biology, molecular and cell biology, and then microbiology and immunology. Those all have a lot of the same classes that match up with the pre-health requirements.
Very good. It's kind of a follow-up to that. Do I need to be a science major to apply to medical school?
Absolutely not. We've had many successful psych, I can expand on that. Psych majors, public health, bioengineering, chemistry. Those are the top ones that come to mind, but absolutely, you do not have to be a science major.
Good to know. Okay, our next question. Can I apply to a nursing program if I do this pre-health plan or path?
Sure. So As I hope folks know, we do not have a degree program leading to RN licensure at UC Merced, but that doesn't mean you can't come to UC Merced and ultimately become a nurse. So that pathway will look a little bit different in that you can come to UC Merced, complete a bachelor's degree in anything. It could be biology, public health, psychology, whatever. Complete the nursing prerequisites, and then you can apply for a second accelerated bachelor's of science degree or an entry-level master's of science. And those are both in nursing. There are specific programs in our state designed for students who have bachelor's degrees in something that then want to go into nursing. So another plug for our website, if you go out to prehealth.ucmerced.edu and click on nursing, there's information on what that pathway looks like. And at the bottom, there's a link out to the State Board of Registered Nursing with the list, the master list of those programs available.
Very good. And then what research and or any type of opportunities are there for someone who is in this path for pre-health?
Sure. So research is definitely encouraged if it's something a student is really excited about. You know, we all saw that giant list of very challenging science classes and students are required to complete. So if students are interested in gaining research experience, there's opportunities for that. And really it's up to the student. So what are you interested in learning? Because we want you to match to your interests. Don't join a research team for a topic that you're not interested in, because that will not be a great experience for you. We do recommend students to review the faculty lab websites to see who's doing what type of research and start contacting them that way. Does that answer that question?
I think it does. Yeah, I do. And the next question is a little bit related. You mentioned faculty. So what type of access do our students have to faculty?
Yeah, that's a great question. I would say our faculty are very, very approachable for students and accessible. So while your lecture sections might be really large, there's faculty office hours and you can always make appointments. So it's something I encourage students to do. Faculty office hours can get really busy as a lot of students will come and want to talk, but making a one-on-one appointment with a faculty member is, your time to sit down, ask them questions either about the class or research, and make that one-on-one connection. And from my interactions with our faculty in the School of Natural Sciences, I can 100% say that they are passionate about student success and they want you to learn.
Fantastic. So what type of research would they be expected to do?
They could do anything. It doesn't need to be in the sciences. It could be in biomedical engineering and in the School of Engineering. It could be health psychology. It could be cognitive science. Again, it's really more about getting onto a team that's doing something interesting to you. That's going to be more meaningful, and it doesn't have to be in the sciences.
Very good. And let's take a look here. Another question coming in. Where are our students landing after they finish this program?
Sure. So our students have ended up in all kinds of programs. So the top of our students who've gone on to medical school, the majority are at UC Davis. And I attribute that to a good match between the UC Davis School of Medicine mission and our mission here at UC Merced and the students that we graduate. But we also have had students go on and complete nursing programs, like I mentioned, BSNs. Some examples include San Francisco State and Cal State Channel Islands. We've had students finish dental school at UCSF and University of the Pacific, pharmacy at those same institutions because they have the same programs. Vet school, one of our alumni is on the faculty at UC Davis Veterinary Medicine. So the sky's the limit, and I didn't even get to the out-of-state program. So it really just depends on what a student wants to do.
Wonderful. All right, so we have someone writing in that they've already chosen their major, but how do they formally enroll themselves in the pre-health student program?
For sure. Well, so like I mentioned, later this summer, we will be sending out an email message to all the new students, and there's going to be a very easy form to kind of say, here I am, I'm interested in a career in healthcare. And what that will do is get your name on our radar. We'll subscribe you to the pre-health advising mailing list, and you'll start to receive information. In the fall semester, there will be workshops available. And like I said, we do require students to attend an intro workshop on their field of interest before making an appointment. And completion of the workshop is really it. So you complete we'll have either in person or Zoom. We'll finish out the fall schedule later on this summer, but there will be opportunities that will meet student needs. And once you've completed the workshop, then you're one of our pre-health students.
Fantastic. So do medical schools review your application differently if you're not a science major?
Nope. What they're really interested in is how did you do in those science classes? What did you take? Like, did you challenge yourself? If you're not a science major, did you do something interesting? I don't know. What did you do? Tell your story. But the main interest or the main lens is, can you perform well in the sciences, and what value would you bring to a medical school class?
Very good. And does the public health major fall under the pre-health program?
Good question. So pre-health advising is a student support program. We're housed in the School of Natural Sciences out of kind of function because that's where the classes live. But pre-health or public health, the major and minor, live in the School of Social Sciences, Humanities, and Arts. So if you're interested in a career in public health, so like a master's in public health, we can assist with that, yes, but not the public health major.
Got it. All right. So if I'm interested in bioengineering as a major, how does that align with the requirements to apply to med school?
Oh, great question. So the good news is there's a lot of overlap. There might be some courses that are tweaked, but for the most part, it matches up pretty well.
Very good. And if a student comes in as undecided, but they would like to declare biology for pre-med, biomedical engineering, or computer science, how would they go about doing that?
Oh, wow. That's quite a combination. I would say you would want to narrow down to one of those majors. And then for coming in as undeclared, I can speak to the declaration process for biological sciences. You can go ahead and declare that anytime in your first term. After that, it's a little bit different. We'll have some criteria. Since I don't work in the School of Engineering, I can't necessarily comment on engineering.
All right.
There'll be more information later.
So if I'm interested in pursuing a degree in dental, attending UC Merced is their pathway into dental school. Is that correct?
Absolutely. So the dental pathway, the medical pathway, the pharmacy pathway, those are all very similar, and they take a lot of the same classes. So again, completion of the prerequisite courses, doing well, taking the DAT, which is the dental admissions test, and then gaining experience. Dental school is one of those programs that tends to require a letter of reference from a dentist. So having experience in a dental office in some capacity is going to be really important. And then you can apply to a dental program after you've completed all those requirements.
Very good. And then are there any particular majors recommended for going on to a pharmacy program? Is pharmacy something that's preferred?
There is no preference for pharmacy. Well, for all of these, you're going to take a lot of chemistry anyway. A chemistry major lines up nicely, but again, there is no preference on a major, and they can choose. Students are encouraged to choose something that they like. Hopefully y'all like science because you'll be taking a lot of it, but you don't have to make it your major.
Very good. And then would it be advisable to double science major with pre-health program?
Oh, wow. So I guess in thinking about double majors, it really comes down to the student motivation and why they're interested in the two programs. It might be possible to do a double major. We would just need to kind of take a look at what does that look like? What do those classes look like? And then again, the why, because that's taking on a lot of really difficult classes. So it's not necessarily advisable. Again, there's no preference. And we really want students to take on programs that they're passionate about.
Perfect. So I want to pursue a medical degree. So are there any opportunities for clinical experience while they're in Merced?
Yeah, great question. So, like I shared, there's some volunteer experiences in our local area, like the UCSF Mobile Heal Clinic. For direct patient care clinical experience, generally students are going to need to have some sort of certification. So either it's EMT, CNA, phlebotomy, or medical scribing. And so there are training programs in our local community, might need to do that during the summer. But those would be paid opportunities, which is great because then you're getting money for your time and that amazing direct patient care experience. So again, that's something that we would kind of figure out together. Again, where does it fit into your schedule? Because you're taking lots of classes and engaging in research and doing all kinds of other amazing things.
How many UC Merced students apply to medical school every year and how many get in? That's always $1 million question.
It sure is. Like I shared, we do not have reliable data on that because students have to disclose their data, their application to us, and they don't always do so. There are always some students that we hear about after the fact, like, oh, I got in, like, oh, we didn't even know you had applied. So we do not have that number. Generally speaking, though, you want to be mindful and look at the admissions data, the medical or professional school that you're considering, whether that's UC Davis, Johns Hopkins, whatever. Look at what their data suggests. So what is the average MCAT and the average GPA of their admitted students? And that'll give you kind of an idea where to shoot for. Again, we have the services available to help students develop a competitive application, and those students who do well in school with the good MCAT score and have rich and meaningful extracurricular activities tend to get in, but I couldn't tell you the number.
It's always a popular question though.
It is, and we don't have the answers.
The next question we have, does UC Merced offer mortuary science or something related?
Ooh, we do not offer anything like that. That is generally vocational.
Very good. Next question. We may have touched on this a bit, but I want to make sure we get this exact question out there for our listener. Are there any direct affiliations from hospitals and grad schools with UC Merced?
Okay, sure. So we are working on enhancing our partnership with our local community. And some of that is due to our partnership with UCSF and UCSF Fresno. So in the past, we've had good partners at our Merced Medical, which you can see that hospital from campus if you're on a second floor of any of the buildings. So that is very close to us. There's also partnership programs going on with Golden Valley Health Centers, which is a federally funded clinic in our local area. So those are two examples that come immediately to mind, but there are definitely more on the horizon.
Very good. So this one is coming in states, I will be getting a certificate for pharmacy ROP class that they took this year. What kind of opportunities might that open up for them with that particular certificate?
Sure. So it sounds like it's probably a pharmacy tech certificate. And in that case, it's similar to like a nursing ROP where they've earned a CNA certificate. So those certifications are great. And I'm always excited when I hear from students that they have them, because that certification is going to open up more doors for them. So pharmacy tech, you could go and get a job working at the local Rite Aid or Walgreens. Again, that's direct patient care experience, and you're going to be working really close with a pharmacist because you're going to need a letter of reference from a pharmacist. So there's definitely community job opportunities there, and the challenge would be fitting it in along with your classes and making sure you're not working too much because school is your first priority.
Absolutely. That's a fantastic reminder for every student. School is first, school, health, and then your job.
Yes.
Okay. Next question. While attending Merced, what are the opportunities to explore dental experience? And would this be after 2 years of schooling?
Sure. So similar to the programs I mentioned, so CNA and pharmacy technician, there is dental assisting available. Again, that's at a community college or an adult education center. But the last time you went to the dentist, the assistant that's walking around with the dentist, that's what that person does. So again, those opportunities, once a student is certificated as a dental assistant, then they can go and obtain employment in a local dentist office or clinic.
Very good. And is there a community hospital that we can get some opportunities for clinical experience? Again, I think we've had similar questions, but just want to make sure we get that info out there tonight.
For sure. We're looking to expand the existing partnerships. But again, the first one comes to mind is Mercy Medical, which is just down the street.
Very good. And if I plan to major in biology, how can I prepare myself for a healthcare career while attending UC Merced?
Sure. So the good news is the biology program already encompasses most all the classes that you'll need for that preparation. Then we would look at the extracurricular preparation. So what do you want to do? Where do you want to go? And how can we help you get there? So kind of teasing out some of those interests and then getting students connected with support services that will provide those opportunities. So whether that's, on-campus employment, student organizations and clubs, or research opportunities.
Very good. And now if I do a forensic science as a major, what does that possibly lead to if I'd like to pursue medicine or pharmacy or a similar program?
Jen, do you want to take that one?
I'm actually in behind the scenes actually answering some of these questions as we're going along. So unfortunately, we do not offer a forensic science program here at UC Merced. However, forensic science tends to be a more popular grad program. And there are some out there that you can prepare for here at UC Merced. If you did want to do forensic science, it's a different pathway than medical school. The program itself is going to be very different, but we are happy to help you with that if that is something you want to pursue as forensic science, but we don't currently offer one here at UC Merced.
Very good. Thank you so much, Jen. And I'm just looking here off to my side screen to see if there's any other questions that are coming in that maybe I have missed. So bear with me here just a moment. We are getting through quite a lot of these. Everyone with your fast fingers behind the scenes, you keep grabbing them before I can read them, which is good. We're getting to everybody, which is awesome.
So as you're looking, Ricky, I can also mention, so one of the things I saw come up a lot and I felt so a lot of students are asking about opportunities in regards to like clinical experience or anything. Currently, we do not have a specific way of placing students in those types of programs. We try to affiliate students with clubs and organizations that might have some type of pathway with Career Center as well. Anything that we see for opportunities, we do promote via emails with our pre-health students, but also we use something called Handshake. So anything that we know that comes across available to students, we promote that as much as possible. This is something that is in the works, so we are working on trying to improve that. But as of right now, there is no direct link for like Erica and myself. We can't actually place you in any of those things. So it's a lot about who you know as well. So I actually tell a lot of students, like, tap into people you know, even asking, your own doctor, your pediatrician, anybody who might be able to give you some insight on who maybe you can get some kind of initial experience with. It's never, it's never going to hurt to ask those questions very early on.
Very good. And I know a question that does keep coming in is one I can actually answer because I don't have to be a content expert on this topic tonight. Is this being recorded? Yes, it is. And you can find that on the events page, which I dropped over into the chat box earlier, and I'll make sure I do that again. And you can find any instant replay from any event that we've had so far over the past couple of months. It will hop you over to our YouTube page, and you can also take a look at anything else that we've done recently. And that's where you can find the recording for all of these events. All right, our next content expert type question is, as a psychology major, what are the different pathways to move forward?
Okay.
So it's reaching from personal experience.
I know. So Jen and I were both psychology majors.
I guess you can go to medical school, but psychology has has actually quite a few different pathways. And so one of the things I would recommend as a psych student is to early on start asking those questions of even like faculty, asking what their pathway looks like. Most students who study psychology will actually go on to some kind of grad school or professional school because that's where you kind of learn the expertise. We can only speak from our own personal experiences initially because we don't deal with that because we're not, psych advisors, but you do have lots of options when it comes to psychology. So yeah, it's never too early to start asking those questions. And if you're not familiar with the website, I don't know if they share this in high schools, but there's a website called ONET. It's onetonline.org, and you can actually go on there and research different careers and different pathways. And it's never too early to start doing research. Research is going to be your best friend when it comes to anything related to your education, whether it be health related or even something outside of the health profession.
Fantastic. Now we have another listener that is saying that they're thinking of going into occupational therapy. So they're wondering what you would recommend for their major.
Any major. Any major. So OT, yes, you're gonna have to take some science classes, but you're also gonna have to take some psych classes and even some arts classes. So you can really choose any major.
Most of my students, and I think for Erica can speak to this too, most of the students that we see with occupational therapy actually will kind of gravitate towards public health or even psychology, just because of the nature of the patients that they're working with and because it's such a unique profession. But that doesn't mean you can't major in biology or chemistry or literally anything. Ultimately, when it comes to the health professions that we provide advising for, it doesn't matter what you major in, it matters how you do. And it doesn't, and ultimately, I know a lot of the questions, and just to kind of touch on this, because I was going to mention it earlier, I know that Erica already touched on this about the statistics and about, we always feel like we're being wishy-washy when we say we don't know the numbers and we don't know how many of our students successfully get in, because the truth is there's just too many variables related. But ultimately what it comes down to is it doesn't matter where you go, because a lot of students are asking like, well, what about UC Merced? Well, it doesn't matter where you go, it matters what you do at that school, because you can go to Stanford University and be a C student and not get into medical school. It's all about how you do. So we love to have our students here at UC Merced and try to make them as competitive as possible. So while we can't give you specific numbers and guarantee anything, we're going to do our best to try to, help support you and help you achieve your goal.
Fantastic information. Thank you both so much for that. Our next question. So someone is clarifying something we talked about earlier. So while attending UC Merced for the dental pathway, they're saying I need to go to the community college for the dental hygiene assistance program. Is that correct? They need to do both?
So if a student is interested in gaining certification as a dental hygienist, and actually I was talking about a dental assistant, those are different. Then yes, the dental assistant certification and training is separate. We don't have that. That's a vocational training offered at most community colleges. And that's not the only way you can get dental experience, direct patient care experience in a dental setting. That's one that we like because you get paid. So that is one pathway. And I've had successful students do that even after they've graduated. So that's an option. It's not the only option. Jen and I will say too that everybody's pathway is unique. There's no one right way to get there. It's really up to you and what feels right to you and what's going to work for your family as well, because this is a huge commitment for the student and their family as well.
Absolutely. All right, next question. For the pre-health summer program, will everyone receive an email about that, or only people that are already in the School of Natural Sciences?
It's going to go out to everybody. And just to clarify, it's just a kind of a acknowledgement, like, we're here, we want to get to know you, fill out this form so that we know who you are, kind of thing. And so not necessarily a summer program. It's more of just information collecting. So we know you're interested in our services, and then we'll start to communicate with you, and everyone's going to get it. So please, my other tip for the night, please continue checking your UC Merced email account all summer long, because we're going to be sending stuff to you.
Definitely. Fantastic advice. No, that's okay.
Just to tag on this. So Erica mentioned about, and as part of the presentation, you do have to attend a workshop to be officially part of the program. So we will be offering an opportunity to attend a workshop that first week of classes. Technically, we'll be offering it like right after move-in and before classes start. So most students should be able to attend. And if you do attend that workshop, then you'll be part of the pre-health program. So we will be offering that. And so if you do subscribe to the listserv, then you will get information about that opportunity.
Fantastic. And does volunteer work count as experience?
Absolutely. So some programs will have specific requirements and they'll say direct patient care, and that's different than, it can be different from volunteer work. And so that's something that will help students kind of suss out when they get down to the application, because there's different kind of buckets that you need to write in. So direct patient care experience, volunteer experience, paid hours, but it's all great experience, and it's all developing you as a competitive applicant. And that's what we want.
Perfect. So what types of career options, jobs, or graduation courses will be open to a student if they are not interested in med school?
Oh yeah, for sure. So we want something for everybody. So if you have sat through this and they're like, I don't want to do healthcare at all, that's totally fine. There's resources on campus to support your career development. So we partner with the Career Services Center to offer opportunities for our non-pre-health students as well. Again, Jen and I work in the School of Natural Sciences, and so we encounter students who are headed towards PhD programs. They want to be lab scientists, or they want to go into industry, whatever. So working closely with the Career Center, you can take different career assessments to explore different careers, but they also support or offer support services in, preparing your resume, preparing for a job interview, finding a job, how do you do a job search, all of those things. But furthermore, there's opportunities on campus to learn about the different careers available. So one of our signature programs with the Career Center is Experience by Degrees. And that brings back alumni from our school who are going to share information about their career pathway and what did that look like. And it's an opportunity to network, hear how somebody else did it, who they were in your shoes not that long ago. And what does that trajectory look like? And maybe make a connection and get an informational interview to learn more, or whatever that might look like. So there's definitely a support for everybody, no matter what your career goal.
Very good. Now someone's written in, they're sharing with us that they would like to become a speech therapist, and they're wondering what types of classes they should take or what type of pathway, what that would look like.
Yeah, so speech therapy, speech pathology, those are going to be a master's program. There might be a handful of classes required for that graduate program that we do not offer. So such as speech language. We don't have a lot of those, but generally some introductory biology classes are going to be required, maybe a chemistry. So we would need to do a little bit more research on that.
And the next question, can pre-health students do study abroad?
Absolutely. So again, it's kind of teasing out which semester is the best to go based on your major, and then what classes you might take. And so you might focus on taking courses in your major or taking science classes for pre-health. It just depends on kind of where you are in your program and the program. Like, where are you going? So if you're studying abroad, if you're going to South Korea and Yonsei, we've got a lot of science classes approved there. That's fine. Same thing for, oh gosh, it's in Denmark. I'm blanking out on the name of it.
There's so many.
I know.
I highly encourage, if students are interested in study abroad and it works with their timeline, I highly recommend it, because it is one of those opportunities where, depending on the program, depending on the cost, most programs are going to be covered under financial aid. And so it does allow for the opportunity to show that you're willing to step out of your comfort zone, go somewhere that is new to you, unique. And there's also other opportunities. We also have students that join programs called Medical Brigade, where they actually go to third world countries, usually during the winter break or during summer. They'll go to third world country for a week or two and actually do clinics there, just to see the disparity of the medical profession in different countries. So there is going to be potentially some opportunities out there. But yeah, study abroad is definitely something we can kind of encourage, we hope to encourage, and we definitely help with.
Wow, it's amazing. All right, the next question, would there be a specific difference in the process if a student wants to go into the medical field as a neurologist?
So neurology is a specialty of medicine. So that's pre-med. So you'd be following a pre-med pathway, and then with an eye towards doing your residency or specialization in neurology.
Perfect. And we are getting closer to the end of our event tonight, but we do have some more questions, so we'll keep squeezing these guys in here. What classes should freshmen take if they're coming directly from high school, and how many classes do you recommend at a time?
Yeah, generally you're going to need to be taking 4 classes every single semester in order to graduate on time. For pre-med students, you're going to want to start with chemistry and biology in your first semester, and math. So depending on your placement, so please take your math and chemistry placement exams on time. Those are going to be really important, and your academic advisor is going to use that to place you in the appropriate level class. Kind of rule of thumb here, you take chemistry every single semester until it's done. Depending on your placement, you might have 6 semesters worth of chemistry to take, and they have to be taken one at a time. So first semester, writing, math, chemistry, biology.
Very good. Next question. Does majoring in biochemistry cover all of the sciences for someone who wants to become an orthodontist?
With careful planning, yes. So there are some upper division biology classes that might be required by some dental schools, such as microbiology, that we would need to make sure that we insert into the program as an elective.
Very good. And what clubs, programs, or organizations are related to medicine? Because this person does want to go to medical school.
Yeah, for sure. So like Jen mentioned, Global Medical Brigade is just one example, and they do service trips to Central America, but there's also, oh my gosh, so many. Delta Epsilon Mu is general pre-health. So there's pre-med students in there. Phi Delta Epsilon is exclusively pre-med. AMSA is out, that's American Medical Student Association. I think they're still active. Those are the ones I can think of, but there's lots of other ones. So the cool thing is there's going to be a club fair in the fall semester. And so that is an excellent opportunity to get out there and see what those organizations are, what they're like, what do they promote, what's their mission, and see if it's a good fit for you.
Very good. And then this person is saying that they are aspiring to become a pediatrician. So they're wondering what pathway they might take. They said that they're majoring in human biology currently, but they're not really sure what to do next.
Yeah, for sure. So pediatrics, again, is a specialty of medicine. So you're on a pre-med track. Like I said earlier, the human biology emphasis kind of wraps up all of those pre-med requirements already. So you don't need to do too much beyond what's already required of you, which is great. So your first step, get registered in your first semester's classes on time, and then reply to our message in the summer, and we'll take it from there.
Very good. And as we are nearing the end, one more question here. What happens if one of your required courses fills up? What do you do?
Oh, for sure. It does happen. We're working with students right now for fall registration, and some classes are filling. Our campus has a wait list, so there is an opportunity to get on that wait list. And there's a lot of movement in some of these classes so it's April now. There's lots of movement before classes start in August. So we recommend, utilizing your wait list, maybe looking at some alternatives. What can we move around comfortably to make sure that you still stay on track? Those are our first kind of lines of defense in terms of classes getting filled.
Very good. And then is there just any last words of advice that either of you would like to share tonight as we end our show here?
Yeah, I just want to thank everybody for coming. Like I shared earlier, we're here to help. And even if you've decided that you don't want to do a pre-health pathway, that's totally fine. We have support services available. And I just really recommend all of you, as you're making decisions about these next steps, is to, if you're able to, visit us on Bobcat Day. Come and get a feel of the classes, a feel of the environment, the space, the people, and come see UC Merced and see if it's a good fit. Because if it is, we're here to help, whatever that next step might be for you after graduation with a bachelor's degree.
And Jen, do you have any last words that you'd like to share tonight?
Absolutely. So yes, thank you again for attending. And ultimately, I know that you're probably most of your part in position of just trying to decide if you want to attend UC Merced. And I really highly encourage attending Bobcat Day this Saturday, because you will get a good feel for the campus and get a chance to meet. Actually, somebody asked in there if they can meet us beforehand, and I said yes, we will both be there. So we really, really care about our students. We're really, really proud of our students and what our students have accomplished. So yes, I know we do not have a direct pathway to most programs, but we are all going to do our best to try to make you prepared for those programs. So we really do pride ourselves on the successes of our students. We just found out a couple of our former student workers got into medical school. I have one that just graduated from pharmacy school and is going to a special program for oncology, pharmaceuticals. So we're very big on just, we take pride in those successes. We don't take credit for them by any means, but we are very proud of it. So, we're willing to help, or just give us a chance, and please, come and see us on Saturday.
Very good. Well, thank you so much to both of our content experts who have been here with us for this entire event, to Erica and Jen, everyone who's been behind the scenes. A huge thank you to you as well for those fast fingers and sending information out to our audience tonight. I do actually have a couple links I'm going to be tossing out, so take a look at that chat box. Start clicking on some of those links to get those pages bookmarked. And a couple announcements before we do end tonight. You have heard about Bobcat Day a few times this evening. I'm going to tell you a little bit more about it right now. It is the biggest event of the spring. We are so excited to be inviting all of you here, our prospective students, future Bobcats, their parents, their loved ones or guardians, your friends. Bring everyone with you. Take a look at our beautiful campus. Take a little walk around. We have a ton of performances for you that day. Everything from our dance groups, our cheer groups. We also have a marching band who will be performing that day. We have over 150 tabling events that day with all of our clubs and orgs that are student run. That includes all of the ones that you're hearing about tonight and many others. Some of the other things that you can also attend that day is a financial aid, a little seminar area in our conference room. So you will have an opportunity to ask those important financial aid questions. Find out how you can afford going to UC Merced. We offer so much financial aid. It is definitely worth a few minutes to talk with someone about that. If you have questions about admissions, about our majors, much like tonight, you got many of your questions answered, but if you have questions regarding other areas of study, we will be there to answer those questions for you. You'll be able to take a tour of our housing facilities. You'll be able to eat on campus that day and take a look at our dining pavilion. Much more that day. So definitely please go ahead and get registered. I dropped that link over into the chat box. A couple other things that day, you'll also be able to get a campus tour. But if you're not able to come to Bobcat Day, you don't have to worry. We also offer campus tours many different days and times of the week, and some of those are even offered in Spanish. So if that is a more comfortable language for you or your family, feel free to request that service and we will make that available to you. A couple of other quick little notifications about some events we have coming up. We have two different programs that are similar, so I'll mention them both: Experience UC Merced as well as Inside UC Merced. Now, the difference between the two, the Inside UC Merced program offers you an overnight stay on our campus in our residence halls. The other one is not an overnight stay, but both of these programs do run through the end of this month of April. Spots are filling up quickly, so you'll definitely want to hop over to that events page, which I did drop over into the chat box. You can click on that link, just scroll down the list until you find either Experience UC Merced or Inside UC Merced. And a couple of the other things that you'll be able to have through one of those programs would be the experience of actually going to one of our lectures, experiencing that with fellow Bobcats, getting to see firsthand what that is like. And again, you'll be able to take a campus tour. You can eat lunch on our campus and just basically explore everything that we have to offer for you. One last quick note, if you haven't yet heard of the Bobcat Den, you will soon be receiving an email about that social platform. What that offers you is an exclusive place to actually talk to other students before you come here. You'll be able to start building new friendships with possible roommates. You'll be able to get peer-to-peer information or questions answered. We are huge on wanting to get to your questions and events like this and all of the other resources that we've been mentioning tonight. A few other things, you'll also have direct access to staff and faculty. So it's an exclusive opportunity just for you. You'll also be able to stay up to date with upcoming events, dates, and deadlines. Wow, that was a lot of information. We're so happy that you spent some time with us tonight. My name is Ricky Hill, the e-recruiter here. We have so much more in store for you. So take a look at that events page, get yourself signed up for another virtual event, or even better, we want to see you this Saturday, April 22nd at Bobcat Day. If you think we're excited talking about it now, you just wait until you're here. You'll get to meet all of us there and just enjoy a wonderful day on our campus. Thank you so much for joining us, everyone. Have a wonderful night.